And joining us now for a closer look at the Wuhan coronavirus is Dr. Amesh Adalja from Johns Hopkins University Center for Health Security in Pittsburgh, Pennsylvania. Thank you very much, Dr. Amesh, for joining us. Are China's travel bans on various cities likely to be successful in limiting the spread of this virus, especially during this upcoming holiday season when we know millions of people are traveling?
Travel bans in general are very risky endeavors, and they often don't result in stopping transmission. And the one we're hearing about in China is enormous. It's been extended to almost a dozen cities. And what it's doing is causing a lot of panic in those cities, and it may paradoxically make it harder to get supplies and medicines to those people in those travel ban zones. We've already heard about shortages, for example, in Wuhan. So I think that this has to be done very carefully. Hopefully it's a short-lived measure, but I'm not very hopeful that it will be effective in containing the virus.
So then what do you think, the authorities should have done instead?
What they should have done is stepped up screening, stepped up diagnostic testing, increased medical capacity in that area, done a lot more epidemiology to try and understand how this is spreading between people. I don't think that travel bans or restricting people's movements so drastically will work. You can ban public gatherings, for example, parades or events to try and limit spread, but using such measures can sometimes have a very negative effect, and it had that type of effect with the Ebola outbreak in Sierra Leone, for example. And you want to have the population trusting you. You want to build a rapport with the population, and I think this is going to make it a little bit harder to actually communicate to the public about what's going on, and it may cause distrust among the population as well.
Dr. Adalja, the Chinese media have said that the symptoms may be far more wide-ranging than just fever or cough or shortness of breath, which is what we've heard initially. But how do we manage and identify potential patients in that case?
You have to remember that coronaviruses have very similar symptoms to almost every upper respiratory viral infection, from influenza to the common cold. And it's going to be very hard to distinguish who is at risk for this just based on symptoms, especially in a city like Wuhan where this is spreading widely. What we have to do is get very simple diagnostic tests developed so that people can do this very rapidly and identify those patients. It's also important to remember that there may be a lot of patients who have mild symptoms or no symptoms at all, which is kind of the norm with coronavirus infections, even including those such as SARS and MERS. So we may be seeing a lot of the severe cases and the cases that require hospitalization or the cases that have died, but there could be a lot more mild cases there, and this may be kind of skewing the perception a little bit, and also something that needs to be identified in order to really risk stratify this virus better.
Well, as of now, the majority of the fatal cases, they involve elderly or those who have underlying health issues. Do we need to be concerned if, we are seeing otherwise perhaps to be healthy people also?
That would definitely be something to look for. And I know that there is a death in someone as young as 36 years of age that's been reported now. I don't know if that person had other medical conditions, but we often see in outbreaks of respiratory illnesses that those with underlying conditions, those that are elderly, are the first victims. And that's important to know, because we want to know, is this capable of killing otherwise healthy people like other viruses have done in the past? And that's an important thing to understand. What's causing the severity in those patients who have severe illness or have fatal illness? And that's an important question that needs to be answered in order to, again, risk stratify where this virus fits in our pandemic threats.
Dr. Adalja, you mentioned that 36-year-old victim, and media reports have said that apparently he had no underlying health conditions. He succumbed to this illness, but we do know that this virus is also mutating, it's adapting. How will such mutations affect researchers who are trying now to develop treatment options or vaccines for this?
All viruses mutate, and coronaviruses are RNA viruses, and RNA viruses mutate a little bit more than other types of viruses, so that's nothing new. What we'll have to do is track these mutations. Right now, what we're worried about is actually taking care of the virus as such, not so much about the mutations. The mutations often don't necessarily mean that the virus is getting different, that it's going to get new properties or be able to evade countermeasures. That can happen, but right now we really have to understand what actually works on the virus as such and track the mutations and not get too distracted by seeing if this is mutating, because right now it's spreading pretty pretty well, I would assume, at least in the cases that we have without any kind of mutation. So I'm not sure that there's any evidence that these mutations are going to play a big role at this point, because they never have really in any of the major outbreaks. It might have been a mutation that's caused this, that started this, that let it go from an animal to a human, but I would be less concerned about ongoing mutations right now and focus on identifying cases and taking care of them.
Dr. Adalja, thank you very much for your thoughts there on the spread of this new coronavirus that we're seeing. That was Dr. Amesh Adalja from the Johns Hopkins University Center for Health Security speaking to us from Pittsburgh, Pennsylvania in the United States.